talk soon after I welcome Dr. Susan Kwan. On behalf of District 19A, I have to express my sincere thank you to today's guest speaker, Dr. Susan Kwan, for conducting a total of 3 health talks in 3 different languages in a week. So very much appreciated, Dr. Kwan. And also this is also my first attempt for this kind of event. So Dr. Susan Kwan, with profound knowledge and experience, is a respirologist and an ICU specialist in Burnaby Hospital in British Columbia, Canada, as well as a clinical assistant professor at University of British Columbia. Let's welcome Dr. Susan Kwan. Thank you.
Thank you so much for everyone. And I would like to share my screen first. And today is the day of the New Year's Eve. We have passed 3 years. 3 years in the pandemic, which is very tiring. A lot of people that we know about, friends and family that has issue. The knowledge to protect yourself is something that we really want to do, to talk to all the Canadians as well as to the Malaysian. And just wait one sec. With all the information that I'm provided here, number one, they are not as medical knowledge so that you can escape for the medical system. And it's not a medical advice for your personal illness. So if anyone want to talk about your own illness in some particular aspect, please consult your family doctor. But this is a very good basic knowledge for everyone to protect you as well as to your family. SARS coronavirus and is variant B1157. What is a coronavirus? A coronavirus is a virus that has little crowns. The crowns is like little flowers that is around the head. And those are the spike proteins that we can look at. Coronavirus has been with us for many, many years and dated back to at least 3,000 to 4,000 years ago. And there are common coronavirus that cause flu-like illness. There's at least 3 or 4 that is very common. SARS-CoV-1 virus, which we know as SARS, which is a pandemic that is short-living, but very horrifying that we know of that occur mainly in Asia. In the COVID case, what we call coronavirus infectious disease is caused by the virus SARS-CoV-2. In 2019, we started the pandemic. The pandemic goes through in different waves. Why there's waves? Because each of the variant or each of the group of viruses that cause the disease go and spread wide to the area. So much so that there is a lot of people get infected. And after they got infected, some die, some recover, some become long COVID. And after that, then we can do the statistics that is coming down. This is one wave, mainly is the alpha. Then we look at another wave, which may be the beta, delta, and now the first Omicron that was discovered on the 24th of November, 2020 in South Africa. But very, very soon, this virus is so transmissible that it goes through the rest of the world. The World Health Organization label this as a COVID-19 variant of concern. And that signifies its transmissibility and also its ability to go through with various nations. And within about 1 to 2 weeks, the first start of that labeling, the virus is already spread over 100 countries in the world. Let's start looking at the origin of the Omicron. This is the beginning of the pandemic, of which in the Wuhan virus, the viral genome was given to the rest of the world through the World Health Organization within a very short time of discovery. And once it's spread, it is allowed that all the different nations can use the viral sequence to do the PCR, to do the initial testing. The initial piece of information is very important because that is saving a lot of time that other countries can use that to develop their scientific tools for detection and also for epidemiology assessment. Throughout that area, it was mainly in China, then spread around to the neighboring land in in Asia. Then you go down, this is B1.1. Once they go down, then there are times of which the mutation occur, and you become a cluster of gamma, beta, and then alpha. And then you go down to delta, and you look at that, each of the little dots represent a variance of what happened to the first. So there are a variety of variants going down, and there is a cluster of delta, because in India, this is a very highly infectious population, and of which that there is a lot of cases, and the vaccination rate was really low. Go back to Omicron. Omicron, when we look at, this is the start of the Omicron, which dated back to about February 2020. So going back, there is a long gap of which that we do not hear anything like the rest of the mutation, so that we have intermediate variants that we can trace. By going back now, November, here comes Omicron. When we look at how the variants are named, so they follow the alphabets of the Greek alphabets. It starts from alpha. Alpha starts from about September of 2020, beta, May of 2020. Also, this group is in South Africa. Brazil will have gamma, and then delta. The alpha, beta, and gamma are older variants, of which that is more or less replaced by the delta at the end. So those alphabets, then there is a number of alphabets, 8 of them, of which they are labeled the virus, the variants of interest, and of which that we hear very little, like from the Brazil, the Zeta, the Eta from multiple countries, in the Philippines, the Theta, Iota, in the United States, Kappa, Lambda, Mu. There's 2 missing variants. Name is Nu. Nu is very similar to New, N-E-W. C is also a common surname in China. So they skip this 2 and then become Omicron. There are other names that is waiting if there are new variants that will come on. Omicron is not just one type. Omicron, it started to also grow into different types. The most popular one that we know is BA.1, but there is a new one is BA.2 and BA.3, which is rare. Those are sister or brothers that, or we can say that they are from the Omicron, different from the same clade that it derived from the origin. The BA.1 is the one that we know and is most prevalent at this time. But now there are BA.2, of which that is now spreading. The BA.2 is much more transmissible than the one, and is highly likely that this sister or brother group of the Omicron mutants will go into spread, and then will have a little different waves than the BA1, and of which that we can see that there is a lot of population data to support that. But the virulent or the killing power of the BA2 is similar to the BA1. Let's go back to some very simple virology. And I hope that this will help you to understand what is a virus and why we're doing all these things to help ourselves. The virus has a center or a capsule. And the capsule is that they are covering the virus and protecting the virus. From the virus, there is little spikes that are coming in and just cause spike, and they are called the spike glycoprotein, of which that this is important, and this look like a key going into the cells through an ACE2 receptor, and then open the cells and let the virus go in. The envelope covers, and there are other membrane proteins that we can see, and small envelope proteins. Inside that, there is a RNA, a single strand RNA that carries all the genetic information of the virus. The virus only has one goal. The goal is to replicate and keep themselves alive. And they have no other energy resources nor any other thing to perpetuate themselves. So before it disintegrates, it has to find a new host, so much so that they can replicate and grow into small daughter or new viruses. This is an electron microscopy, and those are the spike protein. You can see they are folding of all the amino acids that fold together and form a little kind of spike coming out, and they join that of the ACE2 receptor in the cell. When we look at it, the spike protein once joined the ACE2 receptor, which is very common in the upper airway, in the throat, in the major airway, and also less in the lower airways, and it also present in the gut. So once they get the key in, the whole virus went inside the cell. Once they are in the cell, they started to work by getting hostage of our own proteins making mechanisms. So they get the RNA to come out, and they start to replicate in little strands of proteins, of which the proteins are a very long strand, and they need proteases or scissors to cut it into usable segments, of which the usable segments then form this little protein bag, and then group together become the live virus. Timeline of the variants. Whenever the virus replicate one time, there's a chance of getting the copies of the RNA and hence the copies of the protein wrong. And once they are wrong, they either cause a advantage for the virus, of which the virus will be much better in penetration, much better in survival, or that they are less privileged to the virus, of which they will die. We will not hear anything about those of a less privileged mutation, or we only can hear those who are attacking human being. And so that we have now the 5 variants of concern. Alpha B117 is in September of 2020. In Canada, it started on December 26, 2020. discovering this as the first patient in, and also with community transmissible through community. Beta, B1351, and in May of 2020, and in Canada, it started in January. Then Gamma, November 2020, in Canada, February 2021. Of course, the Delta is still at the end tail of its effect in the world, and in some part is still quite a bit of Delta in. So there can be mixture of Delta and Omicron together. So the all testing of the viruses in different countries is very variable. Some test a lot, just like Denmark, and some in Israel. But in other countries, they do not have the capacity even do PCR. So how can you do gene sequencing? And even in Canada and the US, they only select samples of the positive cases to do a reference check. What is the percentage of which type of variants? Now we talk about the spike protein, and if there are change of the mutation in that, this is a number of site, the numbering of the site going into that from a T change in a K, and they are all labeled like that. And you can see that the Omicron has a lot of changes over time. The Omicron collect all this mutation. You can see that in the S protein, in the nuclear protein, the membrane protein, and the nuclear capsid protein, they have a lot of changes. And the Omicron seems to be kind of just jumping out with all these changes. And the BA1, BA2 are minor variation of this group of protein. Omicron, is it deadly? Is that affecting human beings a lot? In December 5th, there's also a sparsely positive cases who can label that as 10, 75, and 150. But now Omicron is everywhere. When we look at Gauteng, that is in South Africa, as a percentage of the wave, we can see that in August, that is the Alpha, Beta, Delta, and now that is the Omicron. The Omicron wave is still going up, but that the death rate, which is in orange, usually follow that of the wave of hospitalization and also cases, new cases detection. The only good thing about Omicron is that the death rate has not come up and following the curve per population. This wave of infection is very similar and is to a similar degree in various parts, depending where do you start first. Once if the case go in, it will follow a similar trend. The trend in Asia, that is from January 2020 to January 16 of 2022. Malaysia is still good, but on the other hand, that this waves of Omicron is highly likely that it will prediction that it will go up. And this is a very good time that we can share with the Malaysian friends what happened in the rest of the world and what may happen to you in terms of predictions that you will need to prepare yourself to handle it. Omicron, this is in the States reported by CDC, and the Delta estimate that is coming on the Omicron. If people are infected with Omicron, number one, the antibody that by natural immunity by Omicron can protect those infection by Delta. So there is cross coverage from Omicron. However, for those who are infected with Delta, do not have antibodies that can cross-cover for Omicron. So much so that if you have a patient that has Delta infection, they can still be infected with Omicron, and the protection is mainly by the use of vaccine. Now going back, we talked about some basic knowledge about the virus. We want to tell what is an infection. An infection has to be an infected body that carry the virus. They produce a huge amount of virus in the air or droplets onto the fomites, like at the table, at the bag, the shopping bag, or other material that is close by. For those who is staying in the air, like that, you cough, you sneeze, then the virus that is staying there, if caught by a non-infected person, again, the spike protein clinch with the ACE2 receptor, they will go inside the body. So let's go back to the infection. So if there is a number of viruses go inside the body, and the body will, within an hour or so, the virus already went into the cell, and then from the cell they develop, and within a few hours, those cells will produce millions of virus. It's not just a few virus, there are millions of virus, and they concentrate in the upper airway. When you blow it out and sneeze it out or cough it out, they remain in the air. So how do we tell about infectivity? Is really the dose of virus or how many virus that you are collected into your body. So is the environment ventilation, the time that you expose yourself, the proximity to the infected person, as well as that how you are protecting yourself with masks or with other coverings. Ventilation is very important. For Canada, we're a colder country, so people try and tend to keep the door and window closed. But if you have an infected person, the best thing is to get the virus out of the environment is by increase the ventilation, get at least fresh air to come in and dilute it. UV lamp is not certain whether it will improve or not, but for any of the table surfaces or any object that is around, like plastic surface or stainless steel surface, it's best to be wiped by disinfectants, of which that it will kill the virus, or just simple soap and water. The virus outside are lipid soluble. So if you use just soapy water to clean the area, it will also disrupt the surface of the virus and get it killed. Omicron, they are infected the upper airway, much easier than the lower airway. And so the symptoms all are related mainly to the upper airway area. So running nose, headache, fatigue, sneezing, sore throat, persistent cough, hoarseness of voice. The rest of the symptoms is going down in less percentage, chills, fever, dizziness, brain fog, and less of that of loss of smell or taste, and muscle ache, muscle pain. And one has to say later whether they will cause less of the long COVID. In the SOE COVID study that is in the state, people use an app and report the symptoms. Omicron symptoms most likely include running nose, headache, fatigue, sneezing, sore throat. And then patients suffer for all these symptoms. Omicron treatment usually does not require medication or prescribed medication, oxygen, and they just need adequate rest. So how is Omicron compared to common cold or flu? Common cold is a whole bag of different viruses, including the RSV virus And also the flu include the influenza A and influenza B virus. So Omicron, as we said, more in the upper airway, runny nose, headache, fatigue, sneezing, sore throat, but less that of high fever, muscle or body aches. The common cold include more of the upper airway and do not have high fever or aches. But the flu-like illness, if anyone got flu, they will have more of fever, aches, and that they said, is a tiredness that goes through the body. The Delta and the Omicron, as Delta wave is gradually subsiding, the Delta usually lasts much longer. They may have high fever with loss of smell, loss of taste, and they have quite a number of lung problems, breathing problem, oxygenation problem, lung damage. Hence, all this is related to going into the hospital, using the need of oxygen, as well as hospitalization and ICU admission, intubation, and ventilation. Omicron, lasting much shorter. They attack faster. They have a very highly infectious rate, and the symptoms last shorter, but the virus load in the body can last much longer than the symptoms. And also that before the symptoms occur, 1 or 2 days prior to that, the person that has already got the infection can shed virus and is also fairly infectious. Fever low to moderate, some dizziness and nausea, no lung or no lower respiratory tract infection. And most of the patients that is infected will not have significant symptoms, and only those who are non-vaccinated will have further injury and going into the lung area. A finger oximeter is a very simple tool of which that we can check using a little finger clip, and they read SpO2, which is the oxygen saturation at that same time, and also heart rate. So if anything is less than 94, you need to take care of yourself. And if it's less than 90, and that is the time that you should go to seek medical advice in your nearby emergency. Again, although we said that overall, as compared to Delta, it is less invasive to the lung. But if a massive population, let's say 10 times more, that will affect infected by the disease, although the percentage is lower, but you add it all together, it's still a very high load to the stretched medical profession, as well as hospital beds and ICU beds. What can we do? If you got infected, try to get yourself tested or get yourself vaccinated. Testing center in BC, is fairly limited, and they have limited time, and also during holidays, they may not open. The PCR test is any test that detect using the virus antigen. So they use a swab, either go to the back of the nasal pharynx on one side, on both sides, and or deep pharyngeal lavage, and took that into the testing kit, and also go into lab. And in the virus, they take three parts of the virus for testing: spike protein, nucleocapsid, and also the envelope protein. So they take different parts. When we test for Omicron, there's the S gene escape, of which the BA1 will test it N2 positive, E positive, but S protein negative. For the BA2, the variation of the spike protein is less and is slightly different from the BA1. So the BA2 will be all positive, and unless that you do subsequent gene sequencing, this may be mistaken as a Delta. Lots of cases waiting to be tested. There's not enough kits. There's not enough PCR testing. And that is a common problem among various countries. So there is a development of rapid antigen test. Rapid antigen test, depending how you take the sample, if you did not take the sample well and just do a little swabs on it, you will not give the definitive answer. So number one, read the package closely. So it's going down to the back of the nose, going to the nasopharynx, turn at least 3 turns on one side, go to the other side, go in and turn another 5 times, dip it in the solution, swirl it, and use the solution to go into the sampling or specimen tray. Now, each rapid antigen test may be slightly different or slight variation of this. So you put the solution of your nasal swab going into solution, and there are two indicators. The control is a control line to make sure that the test is valid, so that the test is something that is the reagent and all this is correct. Anything appear in the T, like a faint line, like a deep purple line, or just one kind of intermittent line, anything positive is a positive test, and that should be corresponding to the PCR test. For the PCR test, you just test the field of the protein, and in order to tell this is Omicron or Delta, you have to do the gene sequencing and then get samples out of the proportion of the test, and then assign to that the population proportion of Omicron. Contact tracing. Contact tracing is that you have a source case, and then you look into different cases that is in contact with that source case. In Canada, I think that this is already surrender to the mass majority of cases. There's too many cases the system cannot handle, and contact tracing, although that is supposed to be the best identification of clusters, but in Canada, there are some contact tracing with a close contact, but otherwise is not very effective. How to slow down the spread of Omicron? Detect the variants to know what we are dealing with. Contact testing required, especially in international travel, for the people that is coming in from a highly infectious population that have high infection rate to a lower population of lower infection rate. Domestic spread by knowing and quarantine those who are infected, and supportive coverage like masks. Prevent COVID-19 spread goes very simple. Go back to the simple, if there is no virus, if the virus didn't get to you, then you will not get the infection. This dropless transmission, so avoid the contact, wear masks, and cough into your elbow, wash your hands because hands touch all things. In closed space, try to get ventilation, avoid crowded space and close contact, and always sanitize, use soap and water or alcohol-based sanitizer. Social distancing, stay at home as much as possible, 2 meters apart, limited contact with others, especially strangers. And now you have to assume that the stranger may be an Omicron carrier. Use virtual contact, just like us doing Zoom. Avoid greetings, handshaking, hugging, kissing. face masks, we always have a question about use of cloth masks, surgical or medical 3-layer mask, KN95 and N95 masks. This will give you some analysis of how the transmissions of spread. So if a non-infected patient with a contact within a room, 15 minutes may be the amount of time that get them infected. So we go up to cloth masks. Both if the person use cloth mask, it increased by about 100% from 15 to 27 minutes. Disposing mask, again, double into an hour. But if you are using the N95, you go up to 20 plus hours. But on the other hand, can you do an N95 all the time? We use it for any aerosol generating procedures in the hospital and wear it every day. But it is not a simple kind of just we endure it because we have to. And not everybody will be able to tolerate an N95 for a long period of time. Whenever we wear a mask, it's important we cover the top part of the nose going down to cover the lower part of the jaw so that there is no gap in between. A mask is a mask. A mask only will protect you if you are wearing it correctly. Vaccination is most important. And I got my 3 doses of COVID vaccine in the hospital. The vaccine in Canada include the Pfizer-BioNTech COVID-19 vaccine, as well as the Moderna, and we have a small supply of the AstraZeneca and also the Johnson & Johnson vaccine. Vaccines are safe, and compare with all the side effects that is reported to what we see in the death and also the long-term effect of COVID-19, vaccines still pose a significant protection to all of us. Vaccine contained egg protein, and vaccine does not make any fertility claim as that some of the news reported. How does vaccine works? The vaccine is getting a small amount of the spike protein, reverse it to get an mRNA to get that of the spike protein, injected into muscle, and of which they develop the spike protein on the cells. The immunity learn about it with the B cell causing antibodies. The antibodies are antibodies like a little cap onto the spike protein, so much so that the key no longer works in the ACE2 inhibitor, ACE2 receptor area. Talking about the BioNTech neutralizing antibodies, for 2 doses, 21 days after the second dose, for neutralizing Omicron, the power is really low. That is the effective line. But after the 3rd dose, 1 month to detect the antibody that it is now way within normal limits for that of the Omicron virus. Vaccination prevent COVID-19 admission, hospitalization of all adults greater than 18 age from January to December of 2021. This includes a small portion of the Omicron. Those are vaccinated, those are not vaccinated. So you can see that it is covering and along the way for those who are non-vaccinated. Remember that it's not only the antibody, but also the T cell and macrophages that help our immunity. We do not have a particular test that we can test for this. And the natural killer cells, the macrophages, help us to kill the virus inside the body and is one part of a very important of our immune system. And many of these T cell changes also change with our own immunity. And that's why there's a lot of people that has like leukemia, lymphoma, or cancer on chemotherapy, or that they have severe kidney disease, liver disease, diabetes, and causing this part of the immunity lower so that we are more susceptible for the Omicron virus or the COVID-19 virus. How can we help ourselves? We should make sure that we have a healthy living, eat healthy, exercise on a regular basis, try to reduce stress. Stress is important because now we are alone in the home without much support and without much socialization. A good attitude and a good mood to try to help ourselves is important. Drink a lot of water. Healthy habits, sleep well. Sleep well has good regulated hours and not just only playing with your TV or your cell. If you are a smoker, please stop now. Smoking damages your lung and increase the chance of getting not only COVID, but the severity of the COVID will increase as you are an active smoker. So it's all the best that you can consider to decrease the number of cigarettes of you that you are smoking and consider to stop it all along with the help of your physician. And there are aids for nicotine replacement for your health. Vitamin D has a lot of interest in that there is, for those who are vitamin D deficient, they have a much higher mortality and morbidity related to the COVID infection. So you look at that, it is also an immune modulator. So make sure that you take your vitamin D at least 1,000 to 2,000 units a day. And if you are vitamin deficient by blood test, you can take a higher dose to replenish your vitamin D first before go down to the maintenance dose. Zinc 50 milligram once daily. They inhibit the viral RNA polymerase, and that helps with your prevention of the COVID-19 transmission and also disease. Vitamin C, fruits are the better source than fruit juices. And the fruits also provide other minor nutrients or micronutrients as well as fiber. In terms of drugs, there are the new drugs from Merck, the molnupiravir. How does it work? It works by inserting the drug into the RNA of which that it will not be able to be replicated. It's more like a lock into it so that to stop the DNA from repeating or replicating inside the cell. So it has to be given early, so much so that the virus do have at the time of viral replication and before it's at the end of the disease. So it's best given as early as possible during detection. Palovit just received the Canadian approval for emergency use. Palovit has two medications. Both are protease inhibitor. Remember that the RNA go into a long string of protein that need a seizure to cut it. The seizure is a protease. The ritonavir has been used for HIV, is a weaker drug, and the main protease that is in here that will come in, and both of them, when they group together, maintain a higher dose and maintain it to be more effective. Again, both drugs need to be taken within 5 days of the onset of symptoms, and only in the non-hospitalized patient in the milder case. And you see, this is neutrality. That means it's not sure whether it's useful or not. And this on the side that it seems to be that it is of benefit. Monoclonal antibodies have been used. There is a number of monoclonal antibodies that is approved for the COVID-19 treatment in hospital. What they are doing is that they are just like the neutralizing antibody or natural infection. They bind to the S protein, stick to it, so that it will not infect the rest of the body. Regeneron is one of them, but monoclonal antibody may not be effective against Omicron. And many, though, if they have a higher, they need even given at a higher dose. The only one that is useful is sotrovimab, and also the DXO604, and this is manufactured in China. Again, one has to remember, although Omicron is relatively milder compared to Delta, but there is still hospitalization, ICU usage. The use of corticosteroids for Omicron is not very useful, remdesivir and also of the monoclonal antibodies. So what we need to do is that if in Omicron, if you have difficulty in breathing and oxygenation, 94%, you have to take a note, and 90% you go to hospital, pain in the chest, mental confusion, or other symptoms worsening. So again, flu is common. Flu can be protected by giving a flu shot. So if anyone that is immunosuppressed and also with a risk for COVID-19, get your flu shot. How can we protect ourselves? So we go back to the good habits of washing hands with water and soap. Make sure that you clean it nice and good. Cover your face when you cough and sneeze. Clean surface, stay home, get your home to have good ventilation, and make sure you're quarantined and try to stay for any potential infective patient. This is the data on January 17. Confirmed cases, 328 million. There's a death of 5.5 million. This is not a small number. It's higher than most of the war that we hear, most of other pandemics. Every day there's new death, variable, but it's about a few thousand deaths and new cases. And I'm quite certain that all this number should be much higher if we tested everybody and tested and also get to all the unknown death and test those people. This number may be one-fold, two-fold, three-fold, or even 10-fold higher. We do not know. Lots of deaths around, and among ourselves and among our family and friends, we may hear of people's death, but 5.5 million is a horrendous number for us to look at. For us, we help to maintain health. We help in the hospital. We're frontline workers, but also that we see people that pass away despite our active action. There's a lot of health professionals that has served with our time, including myself, that all the medical personnel like doctors, paramedicals, ambulance worker, nurses, physio, occupational therapists. They are a light in this whole world. And please remember to send your greetings and blessings to all of us. We are fighting a pandemic together. And also we send condolences to all the family that have a loved one pass away. And at the end, I hope that with information and with the blessings of everybody grouped together to join hands together, will put an end to the Omicron COVID pandemic, so that in the year of the tiger, which will be tomorrow, so everybody will have a much happier day and also in here as a New Year's Eve for the Chinese New Year. I wish everybody health and a very happy New Year. Thank you.